Hello lovelies. Some of you may know that I've been working on something really special. It is called the Willow Sanctuary, a peaceful wellness retreat that I've created in the Shropshire countryside where ASMR comes to life in person. It's a small, nurturing experience designed for deep rest and reconnection, including guided meditation, yoga, woman's circle, mindful rituals, sound therapy, one-to-one treatments, and much more. Every detail has been created for you to slow down, breathe, and restore balance. I'd love to welcome you to the first Willow Sanctuary retreat on Sunday the 25th of January 2026, 10 AM to 6 PM. Spaces are limited and bookings are now open. Click the link in the description box below. That will take you to the website where you can book and find out all sorts of information. I look forward to meeting you at the Willow Sanctuary Winter Retreat. Hello, lovely.
Hello.
How are you?
I'm good, thank you. How are you?
I'm alright, thank you. So I'm Dr. Nicola and I'm going to be carrying out your health check today. Alright, so before we get into the exam, how have you been feeling?
I've had some headaches over the past week or two, so that's why I wanted to come and see you.
Can you just show me whereabouts the pain has been?
It's normally like a sharp pain here.
Okay.
Sometimes at the back.
Have you had any dizziness or nausea or anything like that?
No, not really. Any
ear pain?
Jaw.
Okay. So let's start by taking your temperature first, alright?
Thank you.
Put that there. And just check one more. It's 36.7, okay, which is in the normal range.
Okay.
On the lower end, but still normal. Okay, so get your index finger, pop that there, and just rest it on your leg for me. So this is just going to check your pulse and oxygen levels, okay? 92 is great. Good. And the pulse is around 77, 78. That's perfectly fine. Okay.
Thank you.
Oh, thank you. Alright, lovely. I won't check your blood pressure just yet. Sometimes the anxiety levels can be a little bit higher, so I like to do that a little bit later on. Okay, so I've got this chart. I'm not an optician, but I'd just like to get an idea if your vision is doing okay. So if you can read as far as you can for me.
ELTFPHOLCFDHJBS EPTZOCFDHJLTFPH.
Excellent, your vision is great. What colour is this?
Red.
And that?
Green.
Perfect. Now, I'm going to get my light and have a little look in your eyes. Now, it might be a bit bright, and especially if you're suffering with headaches. If it does get too much, you let me know and I will stop.
Okay.
Alright, so just look at my nose or straight ahead, that's fine. Okay, if you look up for me, down, back at me, left and right. Perfect, that's fine. I'm going to bring in my light now. Okay. Just looking at your pupils. Okay. Okay, just let you focus for a moment. Okay?
Yes, thank you.
Look straight ahead. Look up. To your left. And to your right. Okay, wonderful. Your eyes look fine, nice and clear. Pupils are reacting as they should. Okay, so that's good. And I'm just going to cover one eye. that's perfect as well.
Thank you.
Okay. Now I'm going to have a look in your ears, alright, just to see if you've got any infection going on. Okay, if you can just turn that way for me, thank you. Okay. I'm just having a look right now. I can see a little bit of wax build up, but nothing excessive, okay? It doesn't look like we've got any blockages.
Okay, thank you.
It seems to be just a normal amount of wax deep within, but some on the edge, okay? That's fine. You can just turn that way. Yeah, this side looks exactly the same. Can't see any blockages or just a normal amount of healthy wax, okay? That's wonderful.
They normally do get a bit more waxy in the winter for
Yeah,
me.
that side has got more than that side, but it's just a normal amount. But obviously, because it's a lot deeper, you don't want to be using cotton buds anyway, so that's fine. Now, I'm going to have a listen to your chest, okay? Have you had any recent coughs or colds or flu?
No.
Alright. Now, if you can just move your top down a little bit. That's it. Nice strong heartbeat. Okay, we just take a nice deep breath in and out. One more. And again. Okay, you can relax. Now I'm just going to do it over your top, okay? Okay, if you wouldn't mind just turning and facing that way for me. Your whole body.
Oh, sorry. This way.
That's it. Okay, wonderful. Okay. Okay, take a nice deep breath in, out, in and out, and in and out. Okay, I'm just going to listen over your top. Just breathe normally. Okay, that all sounds perfectly fine. Whilst you're here, I'm just going to feel. Just let me know if you've got any pain, okay?
A bit tender around my neck.
Okay. Okay, I'm just going to pop on some gloves and then I'm going to have a feel around your back of your neck, okay?
Thank you.
Wonderful. Let me know if there's any pain or discomfort, okay?
A bit there.
Okay. Just going to do it that way. That's it. A little bit tight here. Let's do it this side. A little bit tight again, but this side is a lot worse. You've definitely got some tension, which is probably not helping your head.
That's why I thought I'd mention the pain just in case it was linked.
Yeah, it could well be. If we get a lot of tension and, you know, tightness in the neck and the shoulders, that can be contributing to having pain obviously here and then through your head, okay?
Yeah.
Okay, if you can turn that round for me. Okay, you can just leave your hair, it's fine.
Oh.
Okay, wonderful. So I'm just going to have a look at your face and feel. Okay, and let me know if there's any pain or anything, okay?
Bit in my jaw there.
Okay, I'll have a good feel of that in a moment.
And there when you're pressing.
Okay. When was the last time you had your eyes tested?
Oh, that's probably been over a year.
Okay, so you don't normally check for about 2 years, do they? Any visual disturbances or struggling to see anything?
No, not really.
Do you normally get migraines or headaches?
Not normally, but on occasion.
Okay.
But this has lasted a bit longer than usual.
Could be hormone related as well. Does this feel okay?
Bit of tension there.
I see the resident cat is having a moment. She does like to perk up every so often.
It's nice when you're in the waiting room though. And
Yeah, she comes to say hello.
yeah.
Now, if you're having a jaw pain as well, that could be contributing to your headaches.
Okay. I do tend to grind my teeth at night.
And so if you're grinding, if you're clenching down, that could be causing your head pain and in one area as well. So, and again, hormonal or changing the weather. If you've got any issues with your sinuses, but they don't feel blocked. Couple of breakouts, not too excessive. All your glands feel nice and normal as well. Okay, let me just have a little look at your hands. Nails look nice and strong, nice and clear nails. Okay. And they look nice and strong as well. Okay, I'm just going to feel around your wrist, okay? Okay. Any pain in your wrist?
No.
And what about this one?
No. Okay.
Now I'm just going to listen to your pulse, okay?
Yeah.
So when I say listen, I mean feel. So that feels good. Okay, that's good. Okay, so let's do your blood pressure now. We'll see this up. Okay. Okay. Okay, if you turn your arm for me, let's get that blood there. Hang on a moment, we're struggling here. One sec. Okay. It will go tight.
Yeah.
Okay, so that's lovely. Right, if you can just open your mouth for me. Say ah.
Oh.
Pop out your tongue. Okay, curl it up and back in. That looks perfectly fine. Okay, right, I'm going to have a feel around your scalp now. That's okay. Can't feel any lumps or bumps. Okay. I'm just going to write some notes.
Okay.
Can you just sniff for me? Jaw pain, grinds, teeth, okay. And optician was a year ago. And what about your dentist?
Probably about
a while.
Yeah. 2.5 years ago, maybe.
Yeah, a dentist will be able to have a look at your teeth, and if you are grinding your teeth, they can give you a mouth guard.
Okay.
So that might be something to look into to keep your teeth in line and maybe, you know, stop grinding so much. I don't know if you've ever noticed on the inside of your cheek, maybe like a line of thickened skin. You can get that is where obviously you'll bite, you're grinding, so that's like scarring the inside of your mouth. Right, okay. Have you been having any aches and pains in any of your joints, any of your muscles, anywhere you're feeling okay?
Yeah, feeling alright, thank you.
Tell me, how is your sleep at the moment?
Sometimes good. Sometimes headache will wake me up.
Okay, so do you know how many hours you're getting roughly for sleep?
6-7 hours.
Because that's good. And would you say it's straight through, or are you disturbed?
Sometimes disturbed.
Okay. How are your water works? Are you going to the toilet okay?
Yeah, I drink plenty.
Okay. You drink, how much a day would you say of water? Couple of bottles, one?
Yeah, like 4 litres.
So you drink about 4 litres?
Yeah.
Okay, lovely, that's really good. What about your bowels? Are they okay? You're not struggling or anything like that? Good, so that's good. And how's your diet, my love?
Good.
Good.
Yeah, well balanced. Some crap on occasion, like usual.
We're all allowed some of that though. Me more than others.
Sucker for a donut.
Oh yes, definitely. Okay, so that's good. No problems with that. Okay, now have you been feeling fatigued, lethargic, or have you been feeling alright?
Sometimes when my headaches kick in, then I start to feel very tired.
Okay, so your headaches. So your headaches are causing tiredness, which is understandable. Now, are you sensitive to light when you've got a headache?
Yeah, sometimes.
Okay, what about sound?
Not really.
So it's just light. Do you ever notice any crawling at the walls, any auras or anything weird with your vision?
No.
That's good. Sometimes if you are suffering with migraines, you can get that. Now, where your headache is, it sounds a bit like a tension headache. Now, I'm wondering if you've got, you know, your eyes are struggling a little bit and you might need to just go and have another check. Or is it pressure on your sinuses, even though they feel quite free? But if you are having a bad neck, that could be causing tension in your head. But I think a lot of it is due to your jaw and you clenching and you grinding your teeth. Hence why these muscles here are swollen and quite tight. And then with your headache as well, it kind of goes in line with that. So I would definitely recommend going to the dentist, my love, and possibly getting your eyes checked again. Okay. Now, other than that, day to day, do we feel well? Okay. Now, what about your mental health? Are you feeling all right mentally?
Yeah.
You feel quite stable and okay, that's good. Okay. So, any other symptoms or issues you've been experiencing that you wondered, that's a bit of a pain, I don't know what that is? Or do you just feel everything's been pretty good?
Yeah, everything's pretty good apart from the headaches, really.
Well, that's really good. Okay, so good. But headaches, okay. Okay, so what are you taking for relief with your headaches?
I don't take a lot, sometimes ibuprofen. I think they work better than paracetamol for me.
Yeah, some people have said that they are actually better, and some people say paracetamol, but some people take both, and that's going to be quite effective. But down the line, if you are struggling, we could try a migraine tablet, but first I think we need to get your teeth and your mouth in control and check your eyes. And stick to ibuprofen if that what works for you. It would be a concern if the medication wasn't helping, then we could probably look at something else. Okay.
Thank you.
Lovely. Well, it sounds like to me you're very healthy, very happy, and just, you know, having a bit of problems with your head, but like I said, if we can sort that out, things will be fine. But other than that, I'm absolutely happy with everything. Do you have any concerns or worries or anything you want to ask me?
No, thank you.
Perfect. So that is everything I need to do today. Well, it's lovely to meet you.
And you.
And I hope you have a lovely week.
Thank you.
All right, you take care now.
Take care. Bye-bye.
Bye-bye.